Hi folks, my name is Mike Dobbs, and thank you for watching another edition of Government Matters. Today, for the very first time, we have the Health and Human Services Commissioner for the City of Springfield, Helen Caulton-Harris, with us. We're going to talk a little bit about life after COVID, since I don't think COVID is really going to go away. But nonetheless, for any of you who've been paying attention for the last 3 years, Helen has been in the forefront of trying to prepare the City of Springfield for this, to try to answer all of the questions about COVID and the pandemic, and to try to build our base of vaccinated people in the City of Springfield to try to alleviate the disease if you catch it, and to hopefully avoid the disease all entirely. So thanks very much for coming in.
My pleasure, Mike. Thank you for having me.
So let's just start at the most obvious point. We are now being told that the pandemic is over, officially, from a health emergency point of view, that the pandemic is over. So how do we move forward in a post-pandemic America where we still need our inoculations against COVID? It's not a bad idea to have some tests at the house in case you're not feeling well. And you have to be continuously aware about the protocol of isolating if you test positive, et cetera, et cetera. And part of this, I think, is going to be prediction for you about what does the future look like, knowing that this illness is part of our landscape now?
The pandemic has really taught us many lessons, but the most obvious one, I think, is that the public health infrastructure for the Commonwealth of Massachusetts, for local boards of health, is really underfunded and fragmented. So what's important to me is, as we look forward, is how do we assure that 351 cities and towns who must have by Chapter 111 their own Board of Health, how do we move forward and protect our public? The pandemic is going to have lasting impacts for years into the future. And so I anticipate that we will see the effects in education in terms of lost learning, social isolation, as well as the virus itself still being present in our environment.
We hear a lot about the virus mutating, different variants. Do you see this as part of that, having ongoing vigilance about COVID?
Over the past 3 years, we have seen the virus mutate. If you remember very early, when we were educating the public, we were talking about the fact that it impacted individuals over 65 years old. Then we started to really understand that this is a community virus that is impacting all ages. And so I really think it's going to be important for us as we move forward to really think about the fact there will be mutations of the variant. We've already seen that over time. And our concern really is, will our vaccines be able to combat the changing variants? And so I do expect that we will see changing variants in the future.
Looking back over the last three years, what was the biggest challenge for you and your department? Was it getting people proper information? Was it because the information kept changing? It was not the fault of health officials, because we were learning about this thing literally on the fly. Was it getting the information out? Was it getting people vaccinated? What did you see as the challenge that was the biggest for you and your associates?
Mike, you bring up an excellent point, which was the changing information that we got from the local level. So the CDC would give us information, and then it would go to the State Department of Public Health. Then it would come to local boards of health. And so you were seeing this conversation amongst the public health community really changing. And our challenge was to keep up with all of the changing information that was being given to us. So that was a part of an overarching challenge. Then at the time, you had a president of the United States who was also giving information that was not correct. And so there we were combating misinformation that was being given online, being given by our president, changing information from the CDC to the State Department of Public Health. So the shift became something that I think was really one of the barriers to us being able to be concrete in giving information.
Yeah, you know, you bring up something that a factor that played such a major role, and that was the Trump administration and what they were saying. Because in many instances, remarks that were made by politicians, not public health officials, not medical officials, really muddied the water to the extent that it's still going on. If you go online, people are still making comments about cures that they think or preventative measures that they think that will keep COVID away. And it's sort of discouraging to me that clearly after all the science that has been done, that people are still seeking what they like to call as alternative methods of either preventing from contracting the virus or treating it. Does this alarm you that still, after all of the work that's been done, there's still enough Americans who are thinking, no, I'm not going to get inoculated. No, I'm going to use, horse dewormer instead of a recognized treatment. Does that really worry you?
I wrote a piece called Politics, Pitfalls in Public Health. And I wrote that because oftentimes our political elected officials and others get involved in the discussion around public health and do not articulate the scientific facts correctly. And so we saw that with a president who said, if you drink bleach, we can perhaps eradicate this virus. We also heard this will be over in 2 or 3 weeks. So again, the political framework was really giving information that was not correct. And then you had physicians like Dr. Fauci trying to give good information and really being scorned by politicians and others around his advice. We are currently still seeing that misinformation. It is happening around vaccines. It is happening around the prevention. You remember the masking debate, which was really something that was just unimaginable to me, but yet masks became political. So we have pitfalls around public health because we have elected officials often giving public health advice without sound scientific information.
Well, I will wear a mask in certain situations where I'm in a large group of people in a confined area. I still do that. My wife does that. Knock wood, I haven't gotten it yet. But the bottom line is, I don't want to get it.
That's right.
So if I wear a mask and I'm fully inoculated, I feel I'm doing my part in certain situations from hopefully avoiding contracting the virus. But you're right, masks turn political. I think they're still political. Would you characterize, was it a real challenge or even a problem to try to get people vaccinated in the city of Springfield? Because I know Hampden County was lagging behind at certain times in terms of the vaccination levels. Was that a problem, and is it still a problem? Are people still hesitating about getting the vaccine?
Well, vaccines, the city of Springfield has a low vaccination rate, particularly in some neighborhoods. And so it's important that we continue to educate the public around vaccinations. And yes, we still have those efforts going on. We still vaccinate at the Department of Health and Human Services. We still give out test kits. So it continues to be a challenge. Again, that misinformation that is being given around vaccinations. Also, we have to make sure that we are understanding that there is a cultural component, that there are cultures, races, and ethnicities that may have different thoughts about vaccinations, different thoughts about healthcare. You've heard over and over again about the Tuskegee experiment. You've heard over and over again about the distrust of the medical community. And so all of that really plays into whether or not individuals in our community are willing to be vaccinated. So the cultural components are important because oftentimes our information can be culturally destructive, which means we are not understanding the nuances of who we are talking to. So we've tried very hard to be appropriate in our approach and incentives. We've been giving $75 gift cards. We've been doing everything we can to get that vaccination rate up, and we will continue to do that outreach.
And this is a question of complete ignorance. I know that when you put a child in the public schools, we ask parents to get certain vaccinations. I am of the generation that saw, smallpox go away, polio go away, because there was these national movements to get your kids vaccinated. It's always disconcerting to me when I read news reports about an illness that basically had gone away because of vaccination, now coming back because people have determined that they don't want their children vaccinated. Do you think that we'll head to a level where vaccinations against COVID will be part of that requirement for school kids, along with other vaccinations?
I do not think we'll get to the point that COVID-19 vaccinations will be mandatory unless the data tells us that it really is back to a pandemic level, and that we need to consider that as far as the CDC is concerned. So remember, those recommendations will come from the FDA or the CDC. But we've already seen some resistance as far as even vaccinations are concerned right now, when we were at a high level. But you and I'm not sure about you, but I still have that scar on my left arm where I got the polio vaccine, because we remember, I don't necessarily remember individuals who had polio, but if you read our past history, you know the devastating effect that polio, smallpox, those that had on our nation. And so if we get to a point in the COVID-19 pandemic where the CDC, FDA recommends, then I think we can have the conversation. But right now, I do not see us having a mandatory COVID-19 vaccine.
So do you think that this is going to fall in like how we handle influenza? At age 68, I'm told I need to get my influenza vaccination every year. I should probably get pneumonia. This is not required, but on the other hand, the doctors would like, especially older people, to get that. So do you think that this will fall into that thing where a doctor will say to a patient, hey, did you get your how's your COVID vaccination? Is it up to date? Have you had boosters? Did you get your influenza? Do you think it would be more like that, where it's suggested to people that they do it?
I do believe that we are already there. I think that on an annualized basis, we are going to require or ask individuals to get COVID-19 vaccines. I don't think it will be required, but particularly individuals over the age of 65, those who are immune compromised, those with chronic diseases, and also thinking about our school children and households. But I do believe individuals in our community should know their health risks. You should know whether or not you are an individual who is at risk for COVID and be vaccinated, and also individuals in that household, making sure that we keep our elders safe and those who are immune compromised and chronic diseases, and that can be any age.
You mentioned at the top of the interview about the long-lasting effects of the pandemic. There's a lot of educators who are very concerned about the time that was lost during the pandemic and how it's going to affect the educational development of kids, for instance. There's a whole mental health aspect I will readily admit that I didn't do well with isolation. I didn't do well because I was, running a news group with Reminder Publishing of trying to accomplish all the management aspects of the job through Zoom, which was something that many, many businesses and organizations in this country were forced to do. And I have to admit, I didn't like the isolation. That's not part of me, and I know it affected a lot of people. So do we need to really address these kinds of long-term effects of the pandemic? Because the educational part is certainly big. The mental health part, I think, is certainly big.
We have to. I have been having conversations with educators who talk to me about the learning loss, who talk to me about children who really fell behind. But we have amazing teachers who are working hard to try and decrease that learning loss. And so the learning loss and then the social isolation. Remember, many of our children in our educational systems were really excited about sports. We had to shut down some of those very important activities that they were relying on for socialization, also to be motivated as far as education is concerned. So the social isolation, and then absolutely the mental health components. What we've seen around suicide in younger individuals, what we've seen around suicide in Black and brown children, just that hopelessness, powerlessness, loss of control that we have experienced throughout this pandemic that continues today. So I do think we have to pay attention to those components because they are real, and our children particularly are feeling them every day. Then there are our elders, same kinds of concerns. Our senior centers were not active, so that our seniors were socially isolated in their houses. We were delivering meals to their homes and trying to do the best that we could to make sure that we were engaging our seniors, but it certainly isn't the same as being immersed in the culture of having your peers with you. So I think we're going to see the impact of this pandemic well into the future as we try to put some mitigation strategies in place.
Another thing you mentioned I just want to revisit is the funding and organization. As you said, every community in Massachusetts has to have a Board of Health, and that's going to vary tremendously. You have a professional staff. We're sitting in the second or third largest city in the Commonwealth, depending upon birth rates. Mm-hmm. But you have a professional staff. You've got 155,000 people that you've got to deal with. That's a different kind of situation than a small town that may have far less resources than Springfield does, but still has to face the same kind of challenges. Has there been any effort that you know of legislatively of addressing, well, we saw where the funding problems were, we saw where the personnel problems were, let's beef up our health services so if there's another issue that comes up, they're going to be ready. Has there been any sort of legislator advocating for more money for this kind of thing?
There has been. The Massachusetts Association of Public Health is always advocating for more money for boards of health. We have had legislators who understand the opioid crisis and that we need to make sure we are funding those programs as well. So there have been specific funding, but for the infrastructure, when I say infrastructure, I'm talking about the environmental health. I still have to inspect the restaurants. We have to larvicide. Our nursing staff has to move forward. Substance use disorder unit has to do its work. So the infrastructure for public health, suddenly a board of health was said, now we want you to respond to a pandemic, which totally came as a surprise for many of us. To your point, smaller cities and towns probably struggled a little more, but I know the struggle we had in the city of Springfield to make sure everyone was moving forward together and giving credible information. But boards of health in the Commonwealth should be funded at the basic levels, not just for a specific program, to do the work that Chapter 111 tells us we should do, which is mandated.
So let's look to the future a bit. Have you recommended any changes, or do you see changes necessary to basically prepare for whatever is next? We mentioned about how COVID can mutate, but also it's pretty clear what we should have learned is that a destructive virus can completely come out of nowhere and really affect us. So I'm wondering in terms of your department, in terms of other boards of health and health departments across the Commonwealth, has there been discussions about, okay, should we set up certain protocols to be able to handle these things?
I think we do have policies and procedures that we've learned from this particular pandemic, COVID-19. But what I think is the biggest crisis is the healthcare workforce shortage that we're seeing not only in public health, but certainly in the hospitals. I think that will be the crises of the future, is just making sure we have educated and trained individuals who have the ability to communicate culturally, linguistically. I believe that will be our basic concern. In my department, I have several openings for nurses, clinical managers that we are unable to attract to the public health spectrum. So I do believe that the workforce shortage will be the crises of the future, if it's not the crises of right now.
Wow. Well, as you know, my boss, Steve Carey, behind the camera there, always wants me to ask questions about how you got involved in public service. So let's end out with, how did you get involved with public service?
When I went off to the University of Massachusetts, when I wore a younger woman's clothes, I certainly saw the social justice movement. And the fact that I went to try to think of myself as saving the world. I had a father, his name was Robert L. Caulton, who was a Springfield police lieutenant. I learned public service from the best. I watched him speak to the constituents or the individuals he was serving, and he would say to me, the best thing in the world is to have someone say, "Thank you, officer." And so what I knew is that I wanted to serve. And so that is really how I got into public health. My first job was at a health center where all of the nurses were African American. It was called Neighborhood Health Center, and it was in Mason Square. So that's how I got immersed in University of Massachusetts and looking at this social justice movement. And then a father who was really just a role model in terms of how you do public service, and then going to work as a young woman in an environment where the nurses were African American, who made me understand that you can excel in this field, you can work with the public, but always remember who you are, your integrity, and your roots.
In Springfield, you have served a number of different mayors. You've been in this, and what fascinates me is the professionals that we have in city departments who provide a continuity of service, a continuity of knowledge. I think, and I'm not trying to grease you, Helen, but the bottom line is, I think it's always positive for a community our size to have key people who can provide context and history that then they can apply toward addressing issues. And this is not to say that younger people who fill in the position of an older, more established person aren't packing the goods. But to me, it's reassuring that there is that kind of continuity and context that transcends politics. So the service that you've been providing the city of Springfield through your department, it's not something that varies from mayor to mayor. It's a constant, which I think is very, very helpful in trying to deal with issues like a pandemic. unfortunately, I think on the national level, the pandemic was terribly politicized. But on the local level, like municipal governments, I didn't see that, especially in Massachusetts. I saw people trying to pull together to reach solutions for something that was changing almost daily. So with your career and mentioning how basically, you know, your father's service to the city of Springfield helped spur you forward, how important is it to try to mentor younger people, to get them involved in the idea that serving a community like Springfield is a very positive thing to do?
It is a major, for me, mentoring young people has become a major part of who I am. So I believe I've created a department and hopefully have individuals in place who have the skills to move the department forward. But to your point, it's important for younger people, but there's something about being able to have experience in the chair as well. I certainly have worked for 3 mayors. I've had the opportunity and blessing to serve a city I was born in, along now with 6 generations of my family. And so that's important. Relationships are important. I'm able to pick up the phone and get things done that it might take someone else 6 phone calls to do. That's only because of the relationships that we built together over the years. And so I do believe very strongly in mentoring young people. I've done that. But I also believe that there's something to be said about wisdom. There's something to be said about experience. There's something to be said about aging and being able to look at your pipeline, make those phone calls, have those relationships. And so, yeah, it's been an amazing time for me for working for 3 mayors who have all been amazing in terms of allowing me to do the work I need to do without interfering in my work politically. Not one mayor that I've worked for has ever called me up and said, this is who I want you to hire, this is what I want you to do, this is what I want you to say. That's important. So I've had the freedom to be able to do the work, make some decisions that have been supported. I'll take their advice always. If I disagree, we do that behind closed doors, not publicly. So it's been an amazing time for me working with 3 amazing men.
Thank you so much for coming in today. And if people have got questions about vaccinations for COVID or other things, should they just call the office?
Absolutely. We have really skilled staff who's willing to talk and work with our residents. So absolutely call the Department of Health and Human Services, 413-787-6741. Thank you. And Mike, thank you. I appreciate talking to you.
Folks, this has been another edition of Government Matters here in Focus Springfield. Thanks for watching.